is a school Medicaid billing update webinar. We sent this notice of this webinar to all ESD superintendents, special ed directors, as well as business managers, and then several other stakeholders that have been involved in the process around the Senate Bill 111 legislation, as well as the conversation around K-12 school-based health service billing. So real briefly, the purpose of this today's call is to share information that we've worked out in consultation with the Oregon Health Authority and the Oregon Department of Justice, and primarily to clarify in Oregon which local education agency or agencies are qualified for state reimbursement under K-12 IDEA school-based health service Medicaid billing. So just a point of clarification for this webinar, we're really talking primarily about school-based health services for K-12. What we're not talking about today is MAC claiming or EICSE program billing. Both of those are important, and we can chat about those at another time, but they fall under different rules and different statutes as it relates to billing Medicaid. So an overview of Medicaid qualifying school-based health services. These are services that are provided by a school district who enrolled as a Medicaid school medical provider. They're authorized for these medical or school districts are authorized for the provision of special education programs, and they're approved by the state superintendent of public instruction. In order to qualify for billing under Medicaid, the services must be provided by a licensed health professional. The student must be Medicaid eligible, as well as eligible under IDEA. And then the health services that are being provided, both being provided to the child and being billed for, must be identified in the student's individualized education plan. As far as the school medical provider enrollment, and this is something that has not changed. It's been there, and the OAR that's referenced here, 581-015-2005, has not been changed as well. It is intact and historically been the same. A public school district that meets the criteria for provision of special education programs approved by the state superintendent. This includes, and the requirements included for that are school districts operating or initiating special education programs that must have their programs approved by the state superintendent of public instruction in order to qualify for such programs for state reimbursement. And then number two, in addition, the school district must have on file with the Oregon Department of Education a set of insurances and other documentation as required to ensure district compliance with requirements set forth in the statutes, as well as Oregon administrative rules for the education of children with disabilities. The reason I'm pointing this OAR out specifically is this is the language that is pointed to in the provider enrollment agreement that districts who are billing Medicaid or who wish to bill Medicaid for school-based health services sign up for and initial and assure that they qualify under this rule. So coming next steps, Oregon Health Authority is going to amend their school Medicaid provider attachment to clarify that this is, and primarily it's a formatting change, but to again clarify that only those districts who qualify under that rule 2005 are qualified to bill Medicaid and receive reimbursement. School districts who are seeking to bill Medicaid reimbursement for school year 2018-19 will have to update their provider enrollment, including submitting a new updated SM or school medical provider attachment and qualify as a school medical provider by September 1 of 2018. And starting September 1, 2018, only school districts that qualify under this rule will be allowed to be reimbursed for school-based health services going forward. There's, I think, an important note in school-based Medicaid billing. Schools have up to 12 months to submit bill and be reimbursed for services, 12 months from the date of service. We expect this to continue for this final year and as well as going forward. There's a mistake here at the bottom of the slide. It should be 2017-18 school year under that note, not 2016-17. So that's the conclusion of the slides. I'm going to go ahead and open it up. Actually, before I do that, I'm going to share one other piece of information with you. So shortly after this webinar, I will go ahead and post our guidance related to this issue on our school health website, our website under school health. In addition, if anyone wants a copy of the slides and as well as the guidance, email directly to them. I'm happy to do so. Please email me and I'll send it directly to you. This, as you can see, and I'm not going to go over this in detail, but this guidance will cover more of the detail in a Q&A format, or I'm sorry, an FAQ format to provide additional information. In addition to these two webinars, ODE is working with OHA and providing a webinar to current billers tomorrow, which will include school districts that are currently billing Medicaid, as well as we've been asked to provide a presentation to the Senate Healthcare Committee on May 23rd with updates both regarding the Senate Bill 111 pilot project as well as school Medicaid overall. So I got a question posted by Mary Apple online. She is asking, where does a district find the form for billing next school year? The form is an Oregon Health Authority form, so they will be posting it. They have said that they will post it by May 31st. When they post it, I'll include a link on our ODE School Health website that will take you directly to that new form.
Eli, this is Michael Lasher.
Hi, Michael. Yes.
Hi. So currently our districts do not pay for some school-based mental health services for children on IEPs. Those are provided as part of the service package from the Educational Service District. Can they still bill for services that the ESD provides to them, provided that their student receives that service?
That's a great question. So it's gonna depend on. So yes and no. It depends, and it's going to depend on the situation and where that service is coming from. As it relates to resolution dollars and contracted services, a district will be able to bill for those. We are looking into services that are provided by ESDs on that behalf, without the district actually incurring a charge. For school-based health services, the service actually has to really go back to that IEP as a prescriptive document. And so when we're talking about school Medicaid, it's really services being provided to the student by the district, and that may include a contracted service from an ESD or other provider. So I'm not sure. That's not a clear answer to your question. I apologize, but let's follow up. We'll follow up on that and provide additional information.
Do you know when you might have the answer as far as the resolution services piece?
So the resolution services is included in this into this presentation. So that is included in as a contracted, even though it's not a contracted service, it's money that it's a service being provided on the behalf of a school district for that child, and is coming from state school funds.
Oh, so the districts would be eligible to bill for that service.
Correct.
That the ESD is providing at no cost.
Correct.
Great.
One of the questions that we're looking at right now is so I think there very likely continues to be a role for ESDs in billing Medicaid as a support to districts. The key is that billing will have to go under the school medical provider number of the district, and that reimbursement goes back to the district. However, many ESDs do this already, but they help facilitate that submission of that bill, of the Medicaid billing, usually through an electronic billing provider or service. And so there may be areas where ESDs can really work with their districts to support them on that on Medicaid billing, and that would then be a contracted service. You know, and an ESD could charge for that service. Do another call for questions. I apologize if I mispronounced your name, Eleni. Yes, that it will be the call tomorrow. Is considered the monthly Skype call with OHA, and we'll be covering this issue as well as others, you know, that we normally cover. I'll end the webinar with my contact information up. We'll post a recording of this conversation as well as the guidance document, as well as a link to the new provider form, the provider enrollment agreement when that goes live on our school health page. Please don't hesitate to give me a call or an email if you have questions specific to your program, and I'd be happy to walk through those with you. Without any other questions, well, thank you very much. Have a good afternoon.